So how often should you do your hormone replacement therapy injections? On occasion, we will get patients that come from primary care or even some other specialties, and they have been given and put on absolutely terrible protocols, low dose testosterone, bi-weekly or sometimes even occasionally monthly, and they end up feeling absolutely terrible. So they come to us and say, what the hell is going on? So hopefully, if that is you, this will provide some additional information for patients that are feeling that fatigue, that low energy, that inability to recover from workouts, inability to build skeletal muscle mass, libido, sexual function issues. I'm going to be talking about what is the ideal protocol, and this really is not a one-size-fits-all. Again, a lot of these online TRT clinics too, they will do just a cookie cutter approach of saying every guy must be on once weekly injections. That's it. The vast majority of our patient population finds a really nice happy medium with a bi-weekly injection at a dose between probably 30 units and 50 units twice weekly. So that's going to put most men at about, we'd say, about 120 to 200 milligrams weekly. Some older gentlemen are okay, a little lower. And as far as female population, we might be like 8 to 15 milligrams. And then of course, sometimes there are exceptions. We find the vast majority are somewhere in there. For the female population, probably 10 to 14 milligrams on average. So again, how do you decide how often of dosing? That really depends on you. There's a couple of issues at play here. We're talking about patient compliance. What does patient compliance means? That's like we tell somebody to do twice weekly injections or 3 times a week, and they're like, there's no way that I'm going to do that. I don't like injections. The most I can muster is once weekly. And so that's okay too. So if you feel fine at doing a once weekly injection, then that's great. The challenge with once weekly injections, sometimes there are people that feel like their levels just are not as stable. They feel kind of like a waning effect near the end of the week. And so that what we'll do is we'll break that up. And so as far as why is it really not supported to go longer than a week? And that's basically because the half-life of these testosterone esters, especially testosterone cypionate, it does not really support going any longer because you really get that kind of that bell-shaped curve of the half-life of the medication. So by that time, if you're getting 2 weeks out, your levels are really, really crashing, and then you're boosting them up. And for anybody that is still on like a monthly protocol, and we have some guys that have come to us and they've been put on monthly protocols of like 250 milligrams a month, and they feel like absolute garbage. So I hope that's helpful. You try it out and experiment for yourself and see. But if you find yourself kind of waning, or you feel like you're getting a little bit lower energy near the end of the week, you might benefit from increasing the frequency of your dosing protocol. So thank you very much, and we'll talk to you soon.